Diabetes mellitus is a condition that is no longer rare. It is now a household term affecting millions of Filipinos. It is a lifelong metabolic disorder that impacts the way our body processes energy and over time. As future nurses and healthcare professionals, our role goes beyond administering insulin or checking glucose levels. We are educators, advocates, and partners in prevention. In this lecture, we will understand what causes diabetes, how it can be managed, and how community based nursing interventions can help reduce its impact. Diabetes mellitus or DM is a chronic and lifelong condition that affects how the body regulates blood glucose, which is our main source of energy. When this regulation fails, blood sugar levels rise and damage tissues and organs over time. The good news is that diabetes can be effectively managed through a combination of a healthy lifestyle, appropriate medication, and continuous patient education. It is not only a medical condition, it is a lifestyle issue. Because of its growing burden, DM has become a major priority under the Department of Health's Non Communicable Disease Prevention Program. Community health nurses play a vital role in this effort, promoting awareness, encouraging regular checkups, and helping clients adapt to sustainable habits. At its core, diabetes is defined by elevated blood sugar levels or hyperglycemia. This occurs for two main reasons. Either the pancreas doesn't produce enough insulin or the body cells resist its action. When insulin isn't working properly, glucose stays in the bloodstream instead of entering the cells for energy. Over time, this affects multiple organs like the heart, kidneys, eyes, nerves, and even the blood vessels. So, diabetes is not just about too much sugar. It is a condition that gradually weakens vital organs, thus require lifelong management. In the Philippines, over 7 million people are living with diabetes, and that number keeps increasing every year. The main drivers are familiar to all of us: unhealthy diets, physical inactivity, and obesity. As lifestyles become more urban and sedentary, more Filipinos are developing diabetes at a younger age. It is now one of the top causes of illness and death, making it a public health concern that affects families, workplaces, and the economy. As CHNs, we are in a unique position to make an impact by promoting preventive care, educating communities, and helping individuals take control over their situation. before lifelong complications begin. The risk factors for diabetes are divided into those we can change and those we cannot. Modifiable factors include unhealthy diet, inactivity, and obesity, all influenced by lifestyle choices. These are our key targets for prevention. On the other hand, non modifiable factors such as genetics and age cannot be changed, but they help us identify who should be screened early. Lastly, urbanization with fast food, long sitting hours, and less physical activity has quietly contributed to the diabetes epidemic. In a healthy person, insulin acts like a key that opens the cell's door to let glucose in. But in diabetes, this key either doesn't exist or doesn't fit. As a result, glucose builds up in the bloodstream, causing hyperglycemia. Over time, this excess sugar damages blood vessels and nerves, leading to complications such as heart disease, kidney failure, and blindness. This is why diabetes is often called a silent but destructive disease. The damage happens gradually, often before symptoms are felt. Speaking of symptoms, how does diabetes usually present? Let us review the common warning signs. The classic symptoms of diabetes are the three P's: polyuria or frequent urination, polydipsia, excessive thirst, and polyphagia, increased hunger. This occur because the body is trying to flush out the excess sugar. Other signs include tiredness, blurred vision, slow wound healing, and frequent infections, usually in the skin and gums. In our community practice, nurses must be alert to these red flags and refer clients for proper testing. To address the growing diabetes epidemic, the National Diabetes Prevention and Control Program, or NDPCP, was launched by the Department of Health in 1997. Its focus is on prevention, early detection, and effective management at all levels. The program empowers primary health facilities to provide education, glucose screening, and referral services. It ensures that even rural communities have access to basic diabetes care. The NDCP revolves around three pillars. First is lifestyle modification and education, wherein nurses lead campaigns that teach healthy eating, physical activity, and self care. Second, we have community based screening and monitoring, which help detect early cases. And third, access to essential medicine and services, ensuring that no patient is left untreated due to cost or location. When these three components are effectively implemented, the burden of diabetes can be greatly reduced, especially in low resource areas. How do we actually diagnose diabetes in the field or in clinical settings? Let us check what are the different parameters a physician will use to be able to diagnose a person with diabetes. The diagnosis of diabetes is based on specific glucose levels. One is a fasting blood sugar of 126 milligrams per deciliter or higher. This confirms diabetes. If a person has classic symptoms, a random blood sugar of 200 milligrams per deciliter or more also meets the criteria. Another one is the HbA1c test, which provides a long term picture of blood sugar control. And a value of 6.5% or higher indicates diabetes. Regular screening for at risk adults, such as those who are overweight, sedentary, or have family history, helps catch the disease early before complications occur. Once diagnosed, the diabetes management becomes a lifelong partnership between the client and the healthcare team. Managing diabetes requires balance. Patients are advised to combine proper diet, regular exercise, and prescribed medication to maintain normal glucose levels. They should also be encouraged to perform self monitoring of blood glucose, or SMBG, a simple but powerful tool for understanding how food, activity, and medication affect their sugar levels. Most importantly, adherence must be sustained. Nurses provide motivation, counseling, and education to help patients stay consistent. Empowering them to take charge of their care is the foundation of successful diabetes control. Uncontrolled diabetes leads to long term complications. These include retinopathy or eye damage, nephropathy, kidney damage, neuropathy, nerve damage, and cardiovascular disease. Many patients also develop foot ulcers, that heal poorly due to poor circulation. The encouraging part is that these complications are largely preventable. Regular blood sugar monitoring, medication adherence, and healthy habits remain the best defense against these life altering outcomes. Prevention doesn't stop with the individuals in the community, it extends to the whole community level, where community health nurses have a big influence. Community health nurses play a critical role in diabetes control. We conduct barangay level information drives, promote physical activity programs, and teach families about balanced, affordable nutrition. Encouraging regular checkups allows for early detection and management. When a community is informed and engaged, the culture begins to shift from treatment to prevention, making health a shared responsibility. Nurses are key leaders in making these initiatives work effectively. Nurses serve as the bridge between the healthcare system and the community. We screen individuals, educate families, and guide patients in self care practices like proper diet, medication adherence, and lifestyle changes. We also ensure proper referrals for patients who need specialist attention. Our influence lies not only in what we teach, but also in how we inspire patients to believe that prevention and control are within their reach. Effective diabetes prevention requires teamwork. Nurses collaborate with rural health units, local government units, and NGOs to deliver unified services. Establishing peer support groups help patients share experiences and stay motivated. Integrating this program into local health initiatives like maternal health or NCD clinics ensures consistent attention and sustainability. Monitoring and evaluation are essential components of diabetes control. Nurses record blood glucose results, track complication rates, and report data through the Field Health Service Information System or FHSIS. Regular assessment of outcomes ensures that interventions remain effective and responsive. By turning data into action, we can refine our programs and deliver better care to our communities. In summary, diabetes remains a common yet highly preventable disease. With healthy habits, early detection, and consistent care, patients can now live long and fulfilling lives. As nurses, we are at the forefront of this battle, not just care providers, but as advocates and educators. Every lecture we give, every screening we conduct, and every patient we empower brings us closer to a healthier, diabetes aware nation. Let us continue to champion prevention, promote lifestyle change, and strengthen community engagement. Because when we protect people from diabetes and its complications, we don't just save lives, we improve the quality of life for generations to come.